Now to a measles outbreak too close to home. Ontario, Canada, now reporting more than 600 cases, and this may be connected to a case in Macomb County. Our chief health editor, Dr. Partha Nandi, joining us live now. And Dr. Nandi, how concerned should we be here in Michigan, and are there different vaccine guidelines in Canada?
This is really concerning, right? I mean, I'll tell you, I have kids, and I'm really have to look at this very carefully. Measles, we know, is incredibly contagious, and you can get it, Glenda, just by being in the same room with someone who is infected, even after they've already left. So every case needs to be taken very seriously. As for the Macomb County adult, right? They recently had traveled to Ontario, where the outbreak is still growing. Good news is this, that this person wasn't out in public while contagious, according to Michigan health officials. So there's no known risk to the community from this case. That's important. Now, what about vaccine guidelines in Canada? The schedules are similar to ours. Canadian kids usually get their first dose around 12 months, just like here, and the second dose, Linda, at either 18 months or between 4 to 6 years of age. Canadian adults born before 1970 are usually considered immune. Anyone born after that is recommended to have at least one dose. Those working in healthcare or traveling internationally may need two.
So, Doc, what do you think's behind the surge in Canada?
So here's the thing, right? The outbreak initially started, Glenda, with international travel, which makes sense since measles activity increased globally last year. As for the current surge, Canadian public health experts point to a couple of reasons, right? Like missed routine vaccinations during the pandemic, not being able to see a doctor regularly, and unfortunately, misinformation. That's a big one. And just like in the US, childhood vaccination rates in Canada have dropped in recent years. Now, because the measles vaccine is so effective, most folks getting sick are unvaccinated, mostly children. And this includes babies under 1 who are too young to get their first shot. Exposures are happening in everyday places, such as schools, daycares, social events, even healthcare settings. So here's what we need to remember. Measles is not just a rash. It can lead to serious problems like pneumonia, hearing loss, brain swelling, and in severe cases, even death, and that's important to understand. Sadly, we've seen 3 measles-related deaths here in the U.S. in just the past few months. So for anyone who's watching or listening, especially here in Michigan, now is a good time to check your vaccination records. And if you've got travel plans, please talk to your doctor. This is something we can prevent. I'll repeat it. We can prevent this, but only if we're protected.
All right, that is a good reminder, Doc. We appreciate it. Thank you so much.
No problem. My pleasure.
All right. If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll get it right to him.